Dr. David Green, CEO of the California Pain Network. The topic today is what you need to know about epidural injections. These are an outpatient procedure involving steroid and numbing medicine being placed in the epidural space. The epidural space is the area around the spinal cord. The needle does not go into the spinal cord or the nerve roots. Epi means around, okay? Epidural injections are designed to relieve the pain from a herniated disc that's pinching on a nerve and causing either radiculopathy or sciatica. And you can see that here. It's pinching on a nerve root. Red is inflammation. It's either in the neck or the low back. Spinal stenosis is from arthritis, and it starts to overgrow bone and soft tissue and pinches on multiple nerve roots, so an epidural injection is a gold standard procedure there. If the outer part of this disc, let's say on this side, gets inflamed, gets degenerative and gets some tears in it, that can get inflamed and painful and cause irritation of the adjacent nerve root without actually pinching on it. And then compression fractures can be helped with an epidural. There are three different types. The oldest type that's been performed for over 60 years is an interlaminar epidural injection. This involves placing a needle between these two bony areas called the lamina into the interlaminar area, going through the ligament on top and then into the epidural space, putting the steroid in, and that can help relieve pain considerably. The newest type of epidural injection is called a transforaminal, and that's where the needle doesn't go here, but it actually goes out this area. This is called the foramen. Nerve root comes out there, and that's typically where the pinching occurs. So the needle goes into the transforaminal area in the epidural space, and the steroid is placed much closer to the area of the actual pathology. A caudal epidural involves the needle being placed at the very bottom of the spine into this area called the sacral hiatus. A large amount of steroid and numbing medicine is put in, and it migrates up. It can relieve pain from areas of multiple nerve root pinching, such as in spinal stenosis. It's an outpatient procedure. It lasts about 30 minutes. You can do it with just local numbing medicine. Some people do well with IV sedation. Most modern pain doctors will use this real-time x-ray machine called fluoroscopy. For interlaminar, the technique is called the loss of resistance. And usually for all these procedures, dye is injected to make sure that the needle's positioned accurately. Patients go home the same day within about an hour just to make sure there's no allergic reaction or whatnot after the procedure. How well do they work? There have been dozens of studies looking at epidural injections, and overall anywhere from 75 to 90% good to excellent results. You may need a series of 3 injections over a 6-week period for maximal benefit. If the first injection does the trick, save on the rest. If it does a little bit, then you should get another one. It may be that 3 does the trick. The numbing medicine works immediately. The steroid usually kicks in 2 to 3 days later, and it can last a few days to a few months, and then it can be repeated every few months as necessary. Epidural injections are not FDA approved for use in the spinal canal, and this is actually irrelevant. It's not a bad thing. Almost half medications that are being used in medicine today are not FDA approved for the indication that they're being used in. Let's look at a few of them. Neurontin is FDA for anti-seizure. It's used all the time off-label for nerve pain and migraines. Lidoderm is only approved as an FDA skin patch for shingles, but it's used off-label for back pain and all kinds of other numbing needs. Propranolol is used all the time as a high blood pressure medication, but off-label it's used a lot for performance anxiety, right? So that is not necessarily a bad thing, and in this case it's definitely not relevant. The top pain management in California is with the California Pain Network. Multiple clinics throughout the state, including San Diego to Orange County, LA, Bakersfield, Inland Empire, all the way up to San Francisco. Over 50 insurances are accepted at the affiliated clinics, with over 25 treatment options being provided, including all these types of epidural injections. There's over a 90% success rate. The doctors are board certified, award-winning. The complications from an epidural steroid injection are much less than 1%. That can include infection, bleeding, nerve injury. Very rarely you can have a nerve damage, but the benefits far outweigh the risks. Visit us on the web today at californiapainnetwork.com or call us at 877-877-8556. I'm Dr. David Green with the California Pain Network.